that mentioned that as well.
Well, that's interesting about your analogy to the city, because I live in Bristol, and of course we looked at my GP practice, and which I do moan about quite a bit for not getting an appointment. Hence the post, but I can see how hard they're working. And when you looked at the data, I think they were being paid just £120 per patient. How can a GP surgery survive looking after patients on £120 per patient, especially if a patient is having an appointment several times a year, or they're having to go for checkups, for blood tests, for other tests? How is that possible for a GP surgery to survive?
I don't know.
The short answer, Gemma, is it isn't, and this is one of the fundamental problems with primary care. The whole contracting structure, the whole payment system for primary care, and the liabilities that GP partners hold is fundamentally flawed. So in my neck of the woods, the average per pound per patient is about 150 something pounds. You know, you're talking less than 50p a day. That's lower than cat and dog insurance for your pet.
Mm.
And the number of consultations per patient is climbing post-COVID. Demand, for a variety of complex reasons, is skyrocketing. There isn't the capacity within the system to see everybody. And as a direct consequence of some of this funding lunacy, we're now in a situation where we have newly qualified GPs who practices cannot afford to employ. So that is why you can't get an appointment. On top of a prolonged, multicoloured political push for on-the-day access as being the most important thing, when all of the data from comparable populations in Europe clearly points to continuity of care being the thing that results in a lower total cost to the healthcare system. So less morbidity and less mortality. So we've got divergence between data and politics, and we've got a really clear problem with funding, and that's why you can't get an appointment.